77 WABC.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple-board certified, Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. I hope you're fine and had a great week and looking forward to a good weekend. We are happy to be together and talking about a lot of new cases and a lot of news articles. Always wonder how we can top last week's cases, and for some reason every week it comes more and more and more. So I want to talk to you about a lot of health issues today. There's a lot of news issues about cancer and other things we should talk about. We are live in the WABC studios, and we have Bruce, who's running the program, who's fantastic, and he's available. Just call if you want to speak to me. He'll pick up the phone and put the call right through. We're at 1-800-848-9222, 800-848-9222. This is Dr. Lederman. We are live. You can pinch us. We're so live. I want to start out immediately. We had a man who came in late yesterday, about 3, 4 o'clock. He's a 79-year-old man. He's a heavy smoker. He's 79, but he smoked for 67 years. He started when he was 12, and actually most smokers start in their teen years. He came in and he said, "Look, Doc, I know I had coronary artery bypass graft, had a heart surgery because of my smoking. I lost my leg because of smoking." His left leg was amputated from above the knee down due to vascular complications from smoking. He had the heart disease from smoking. He said, "But what's really bothering me now is I used to be a 38 waist, and I'm now down to a 30 waist. 30 waist. Most of us weren't 30 waist since about 9th grade. He weighs 130 pounds, and he's 6'2". And that 130 pounds is with his leg prosthesis. Now, he smoked for 67 years. He says that he's gone to all the big hospitals, and no one can find out what's wrong with him. So I examined him. I heard his story. I examined him. And when I was examining him, I found this big mass in his right groin. Now, he was with me an hour or so. Most patients spend about an hour with me. And I said, do you have any lumps or bumps? Do you have anything in your body? He said, no. But then a few minutes later, I examined him, and I found this mass in the right groin. It was like almost like an apple, or smashed down apple in the groin. I said, wow, what's going on here? He says, oh, yeah, I forgot to tell you. And also, when I touched it, it was tender. So no one should have a mass the size of an apple in their groin. He's wondering why his weight is so low and losing weight. I'm wondering why he's smoking after coronary artery bypass graft, heart surgery, losing his leg from smoking. He's still smoking. I asked him why he's smoking. He says, I'm addicted. I said, well, you're paying such a price for smoking. How much pleasure can it give you? You can't walk normally. You have this prosthesis. You have heart. And now you're down to 130 pounds, 6'2", and you've got this mass in the groin. So as we talk about, we arranged for him to immediately have an ultrasound and a needle biopsy of that. I offered it. He didn't want to have it. He wants to go home and think about it, which is great. Everyone should think all they want. Everyone is the president of the United States of their own body and can decide himself. But I suspect he's going to have it because he came in wondering why his weight is so low, why he's so skinny. And we found this abnormality, and it's tender, and I'm sure he's going to go home and feel it 50 times and probably call me back over the weekend or call me back Monday to have a little needle put in to see exactly what that mass is. Biopsy like that is easy. It's painless. We numb up the skin, stick a little needle in, and then you get your answer back. It's a lot easier than getting cut open, and for him, it probably would tell him what is going on and what then we can do about it. So for him, we probably found the answer. And that's another point is a lot of times people call me up and say, Doc, I'm 130 pounds and I'm 6'2", and I can't figure out why I'm losing weight. What should I do? And my usual answer is come in, sit down, and spend some time together, and we'll probably find the cause. So for this man, we found the cause, and it just reinforces my usual answer, which is come in and sit down and spend some time together. We're not going to rush you out of the office. We're going to spend time to find the problem. Now, another man who's been actually coming for about a month, he's a man whose son heard us on the radio one Sunday. He had been in a hospital in New Jersey with lung cancer and brain mets, and he was there 2 weeks, nothing happened. Came to us, heard me Sunday on WOR. We have 4 programs on WOR. Heard me Sunday. They came in on Monday. We got them all staged up, started treatment. Instead of doing whole brain radiation, which was going to take place at the other facility, we focused in on only the cancer area, focused beam treatment. So I think everyone would rather have their cancer treated than their healthy brain treated, wouldn't you? I think so. So we hit the cancer, and also instead of 20 treatments, there's only 5 treatments, so it was more focused, shorter, more effective, less nuisance, and less harm to the healthy tissues. He also was coughing up blood. He had a lung cancer primary, so it was a big lung cancer. And again, instead of 6 weeks of daily radiation, we were able to treat him just in 5 treatments with radiosurgery, which is a technology we pioneered. Radiosurgery is not surgery. There's no cutting, no bleeding. We make a stereotactic frame for the patient, so it's a custom-made mold. It's all painless. It's all open. Treatment takes about 10-15 minutes. Patient comes in, gets a treatment, and goes home, or goes to work, or goes shopping, or goes across the street to Macy's. And within 2 treatments, his bleeding stopped. Now, for those of us who have seen someone drowned in their own blood, it's terrible, and it's frightening. And luckily, we were able to see him quickly. As we say, we will see a patient within one business day. We'd rather work more than you sit home and suffer. So luckily we were able to take care of his brain, take care of his lung. When he came to us, he had cancer that also spread to the hip bone, and we're treating the hip bone with focused beam treatment also quickly in just a few treatments. And most likely, we can't guarantee anything, but most likely our success rate there is going to be 90%. Now, the brain has been fine. The lung stopped bleeding after our treatment, and we anticipate that the pain in the hip will go away. This is a cancer that's got into the bloodstream before we saw him, spread to the bone, and is growing through the bone, eating through the bone, and pushing on the nerves, causing pain. So it's called a bone metastasis, meaning it's part of cancer that spread to the bone through the bloodstream, and we are very effective at stopping or shrinking. And believe it or not, and I'll show you pictures when you come in, actually, most commonly the bone will heal up. So these holes in the bone that you see when the cancer eats through the bone heals up. My first day in medical school, I remember my professor of anatomy said, the second most fluid part of the body after the blood is the bone. And it's true. The bone is a fluid part of the body that will heal up. Just give it a chance. Kill the cancer. Let us kill the cancer, and most likely it's going to go away. I want to speak also about a woman I spoke to you a little bit about last week. She's a woman who came from California, 44 years old. She had cervix cancer. This is a woman. Now, cervix cancer is a cancer that should be almost totally curable. So how can a 44-year-old lawyer from California with 2 kids end up with metastatic cervix cancer? Well, the answer is probably complex and simple. Cervix cancer is spread by sex, mainly by human papillomavirus, which is a infection that's caused by sex. So someone, either her or her husband, slept with the wrong person. We don't know. She got a pre-cancer lesion in 2002, which was taken care of. It was detected by pap smear and taken care of. Then she moved to another state. She said she lost her insurance, and from 2007 to 2013 had no pap smears. So it's really dangerous for a woman to go all those years without a pap smear. She went all those years without a pap smear. She was a lawyer with 2 kids and a husband. It's hard to believe. And then in 2013, a decade after the original dysplastic changes, the pre-cancer changes, she got a pap smear, was found to have an invasive cancer, and she decided then to lose her uterus. She had surgery on her uterus. When they removed her uterus and her cervix, the cancer had already spread to 3 lymph nodes. At that time, she declined the usual treatment, which would have most likely been successful. And listen to this, she went on mistletoe and vitamin C for the last 8 months. And on vitamin C and mistletoe, the cancer grew, and we have documentation of that because of PET scans and CAT scans. The cancer grew. So the vitamin C drip and the mistletoe did not work. She heard about our program, and she flew in just a few days ago. She started radiosurgery. We've tried to convince her to have potentially curative therapy. And I've tried to tell her how a 44-year-old woman having curative therapy should live until she's 80 or 90. And for whatever reason, she's been fixating on these treatments that have no data. Mistletoe has no randomized data showing benefit. Vitamin C drips, actually, there's data showing there's an increased death rate. So after extensive conversations, she's decided to proceed with potentially curative therapy that's proven. There's a track record for proven therapy. Cervix cancer usually is very successfully treated with radiation. There's a lot to talk about.